Hey everybody, welcome to Afton, Wyoming. We're here in the mountains where it's cold and a lot of snow. But we're going to do a positioning video today, and today's video is on the elbow. Okay, the infamous elbow. Elbows can be awesome, but they can also be tough because elbows hurt. When you hurt your elbow, it hurts. It's hard to move. But projections, we're looking at an AP, an external oblique, a lateral, and I'm also going to show you how to do a couple trauma shots, and that's called acute flexion views. Okay, SID, source to image distance is 40 inches. Central ray is right and smack dab in the middle of the elbow joint. Easy peasy. We need to include both medial and lateral skin margins, so we need to get the entire elbow. We need to include 1/3 of the proximal radius ulna and 1/3 of the distal humerus. Okay. Technique 55 to 60 kVp, 3 to 8 mass will get you there. Whatever comes up on your machine, usually for an elbow, is perfect. So external, let's see, tips. Okay. External rotation, the reason we do that is to demonstrate the radial head free from superimposition. When we do our critique videos, I'll show you that. But that's one of my favorite x-rays to do, actually, is the external, because it's a cool one when you get it right. So, and another tip is the entire arm needs to be on the same plane on every view, except for the acute flexion, of course. Anyway, okay, so we've got a new model today. This is Emily. She's one of the awesome MAs here at Afton. And we are using a traditional machine versus the Paxis. And I will do a video tutorial on this as well, so we know what we're doing. I basically just hit the all release and it allows you to move the head around, okay? And where is our... So with the traditional rooms, we have an external plate for our IR, okay? And this does the same thing as the Paxis. It's all built in and it's all digital. These ones are computed, so the image is actually saved and then transported to the screen. So it's a little bit different, okay? And we'll talk more about that in the tutorial. But elbow, first picture we're gonna do is an AP. Okay, so we're going to have the patient put their arm out in front of them, just like that. And you'll note that we've got a little bit of distance between the cassette and Emily's arm. We can either have Emily stand up, or we can move the table up so it's all in the same plane. Okay, all right, we'll try and get that as straight as we can on there. Okay, we can just turn our box to follow her arm up, okay? And our central ray is going to be right in the middle of her joint right there, okay? And we're going to collimate to include both medial and lateral skin margins, 1/3 of the radius and ulna and 1/3 of the humerus, okay? So we want to include at least 1/3 of both superior and inferior bones, okay? Just like that, we will put a lead shield on Emily, and we will mark it. This is actually marked incorrectly. Pretend that's an L marker, okay? Okay, there's your AP, and we're going to shoot this at 55, usually right around 5 mass, and it'll be beautiful. Okay, let's move on to our external oblique. So external means that we're moving out, right? Okay, so, excuse me, the best way to do this is to grab the patient's shoulder and just dip it down, okay? Just like that. And that's going to bring the medial elbow up off the IR right here. And we're going to be able to see the space between the radial head and the ulna right here, okay? It's a really neat picture, actually. Same collimation. Our CR is going to go right into the joint. Medial and lateral margins are seen in 1/3 and 1/3. The only difference is we over-exaggerated the angle of the elbow. And we did that by dipping Emily's shoulder down. And that's the best way to do it, especially if they're hurting. You don't want to go turning their wrist, okay? It's easier just to grab their shoulder and dip it down, and then they'll follow, okay? So this is our external oblique. Same technique, same everything, same marker. Okay, let's do a lateral. Okay, we're going to put the patient's arm in a 90-degree angle, okay, just like that. And note that we've got some OID there, object to image distance, and I think we may be maxed out, okay? So with the Paxis machines, you could move this up so that that was all on the same plane. With this machine, you're just going to have your patient dip down a little bit, okay? Have them just scoot back a little bit so that the inside of their bicep is touching the image receptor, okay? All in the same plane. Very good. Okay, our central ray is going to be in the same, right into the middle of the elbow joint. Come on, stay on. There we go. Okay, 1/3 and 1/3. We want to make sure we get our anterior and posterior fat pads. Okay, make sure that wrist is perfectly lateral. Okay, make sure that radius is over the ulna, 90 degrees. And we're going to mark that in the light. But remember, it's important that we get the 1/3 and 1/3 so we get the anterior and posterior fat pads. Okay, we're using the same technique, 55 at 5 or 6 or whatever comes up on your machine will work, okay? Okay, now that's your lateral. Okay, that's your elbow series. Now, if you have a patient that cannot flex their arm out, okay, there's one thing that we can do, and this does happen every once in a while. Okay, say we've got Emily's arm and it's like this and she can't move it. Okay, we're just going to take 2 pictures. Okay, we're just going to have her bring her arm like that. Central ray is going to be the same, right into the elbow joint. Same collimation. And marked. Okay, and you'll take that picture. Okay, same technique and everything. So for the second flexion view, we're going to have Emily stand up, actually, and we're just going to do the opposite. Just where they can bend their elbows, or we're going to take that picture. Okay. So we're taking 2 pictures instead of 1 for the AP, okay? And those are the flexion extension views for trauma, okay? And the lateral, you can go ahead and relax. The lateral, they're usually pretty easily put into that position, even when they're hurting. So anyway, that is an elbow series for you. Just pay close attention to your positioning, work on your external obliques. When you see your x-ray, you're going to see a split between the proximal radius and proximal ulna. Okay, if you can get that split, you know you have a good picture. So just remember to include 1/3 and 1/3, and you'll be in good shape. Just remember to collimate properly and shoot your technique where it needs to be, and you'll be fine. Okay. Anyway, thanks for coming by today. Thank you, Emily. I appreciate it. Thank you, Kate. So questions for the day is, who's our model today? Okay. And the second question is, where are we today? All right, guys, thanks. See ya.